Hi, I'm Camille, and today I'll be talking to you about depressive disorders. I chose this topic today because I believe that this particular disorder is something that is not recognized as such, especially here in Jamaica, where I live. In many instances, I believe that depressive disorders go untreated or overlooked. I'm hoping that the information provided here today will improve our awareness and help us to be able to highlight or to notice what are the warning signs of depressive disorder. I'm hoping too that I will provide information that will help us to understand how we can treat depressive disorder. Now, depression is something that affects all of us. It is one of the most common psychiatric disorders. It is the second leading cause of disability worldwide. It affects 298 million people each year. And approximately 50% of those who have been diagnosed with depression have failed to show any significant reduction in symptoms. Let's look at depression from a multi-level approach. Now, what are depressive disorders? Depressive disorders are a group of related disorders that are characterized by depressive symptoms. Now, they are characterized in three main categories. They are major depressive disorders, persistent depressive disorders, and premenstrual dysphoric disorders. But before we go into those disorders, let's talk a little bit about depression. Let's look at depression from a psychological perspective. Now, what we notice is that persons who tend to be depressive is that they practice what is called rumination or co-rumination. What is that? Something that many of us are familiar with. What they do is they rehearse the problem or the stressor, but not in a moderate way. They tend to overdo it and belabor it. And what we find is that this helps depressive symptoms to continue or to thrive. Also, there is inadequate or insufficient reinforcement for that person. Usually that person tends to practice to think very negatively. There's an error in the way they think. So for example, they will generalize thoughts or they will personalize thoughts, usually negatively, and that would affect them and allow depression to thrive. Also, these persons tend to practice self-blame and guilt and contempt, and these are feelings that clearly would allow the person to remain depressed. Finally, they learn helplessness. Learned helplessness is something that is noted in families. So mothers will pass this on to children, grandparents will pass this on to their children, etc. So families that usually have depressive symptoms have to be very careful because this is something that is noted in families. Socially, we find that persons that are grappling with depression tend to have a lack of social support. We find that those persons very early in their lives, they are dealing with neglect or maltreatment or some parental loss. Also, persons who are undergoing a significant amount of work stress with very few opportunities to make decisions, those persons are predisposed to depression. Biologically, researchers have found that there is a correlation between stress and major depressive disorder. What happens in the brain is that there is a shrinkage in the hippocampus. Now, this is the area in your brain where serotonin and dopamine, those are the feel-good hormones, that's where they operate. Now, these hormones are essential to fight against depression. So the less of these hormones you have, the more depression will thrive. They also noted that females are more susceptible to, biologically, they are more susceptible to depression. Why? Females release hormones, especially after puberty. These hormones, like cortisol, are stress-related hormones. And what researchers found was that early exposure to stress will increase the level of cortisol in women and cause them to be susceptible to depression. Socially, we find that persons grappling with depression have a lack of social support. Very early in their lives, you may notice neglect or maltreatment or some parental loss. Persons who are experiencing work stress, we find that those persons are prone to depression if there is not an amount of outlet provided for them to make decisions. Socioculturally, we find that females are more susceptible to depression than men. This may be as a result of gender roles that are assigned. For example, a woman might not feel that there is equal opportunity in terms of employment, and this may bring on a stressor which may lead to depression. Also, sexual orientation might be one reason that persons may be depressed. So if a person identifies as a gay or a lesbian or bisexual, that might bring on depression. Exposure to discrimination, racism, for example, may also bring on stress, and that may lead to depression. Now, in terms of diagnosing these disorders, DSM-5 gives us a clear outline of how we should identify and categorize these disorders. Now, for major depressive disorders, the person should have at least one major depressive episode not lasting in excess of a week. They should not have a history of mania or hypomania. Prevalence is usually noted in women more than men, and the age of onset is usually late 20s, and it usually impairs functioning. For persistent depressive disorder, it is noted that it lasts for as long as 2 years and no more than 2 months symptoms free. There's a prevalence again in females as opposed to males, and the onset is usually in childhood or adolescence. And finally, for premenstrual dysphoric disorder, there is severe depression, mood swing, anxiety, irritability, usually before menses. It is common again among women who have a history in their family of depression, and the onset of this is usually late 20s, and earlier is also possible. Now, what of treatment? There are a number of treatments that can be applied to persons who are experiencing depressive disorders, and the type of treatment that is used is on the basis of the severity of the depression. Now, in cases of very severe depression, one treatment that is recommended is brain stimulation therapy. Now, in this therapy, electronical voltage is sent to the brain, which produces convulsion that lasts for no more than 15 seconds. And what it does is that it increases the metabolic activity in the brain and helps to produce those feel-good hormones that will help to suppress the depressive symptoms. Another treatment is to have cognitive behavioral treatment, which helps to alter the behavior of the person. It reduces depression by encouraging the person to change their behavior, to practice calm mindfulness, to consciously think and appropriate their thoughts, and ensure that they promote acceptance rather than being judgmental or evaluating or practicing rumination. Also, another treatment that is popular for a person with depressive disorder is to get physical, get involved in physical activity, and ensure that you have a healthy lifestyle, ensure that you focus on gratitude and increase in positive emotion that will help you to have a more meaningful life, a life that reflects on positive things, and focus on your strengths versus focusing on your weaknesses. Another way that a person can counter depressive disorder is to take medication. Medication is, whilst the outcome might not be at its best, treatment biologically can be had via antidepressants. What antidepressant does is that it increases those feel-good hormones in the brain and allow the individual who is experiencing the depressive disorder to lessen those symptoms. We find that treatment works better when it is coupled with behavioral therapy. That's biological treatment. When coupled with behavioral therapy, it tends to work better. Doing this research has been extremely beneficial to me. Can say that I now understand depressive disorder more clearly, and I'm able to identify where there are instances of depressive disorders, and can even make suggestions to persons on how to treat with these disorders. I can say that I've benefited from learning and doing a research on depressive disorders.